Hello, everyone, and welcome to the second half of our ENPN lecture. My name is Zaza, and I will be covering parenteral nutrition with you today. We will go over the basics as well as some of the commonly tested calculations on the RD exam. Make sure to have a piece of scratch paper, a pencil, and calculator handy. Let's get started. So, parenteral nutrition. This is the provision of nutrients via the intravenous or IV route. However, I would like to start by going over the indications and contraindications for PN because the guiding principle of nutrition support is to use the least invasive method of feeding when possible. PN is the most invasive method of feeding we can use, so we need to be very mindful and ensure that the appropriate patients are selected for this method. So generally speaking, PN is indicated to prevent the adverse effects of malnutrition when the GI tract is not working or sometimes not even available. Examples are severe GI dysfunction or malabsorption, so think of IBD, Crohn's disease, or ulcerative colitis, GI obstruction, or short bowel syndrome. A patient may also be unable to take oral feeds due to critical illness, surgery, or impaired swallowing. If a patient has a non-functional GI tract, PN should be started within 7 to 14 days. However, if a patient is severely malnourished or highly catabolic with a GI dysfunction, PN should be started within 1 to 3 days of hospital admission. Now let's look at those contraindications. Most obviously, our main contraindication is if we have a working GI tract. If the gut works, use it, right? Next, patients with a foreseeable return to adequate oral or EN intake within a short time frame would be contraindicated as well. We are really wanting to avoid these invasive procedures when we can. And then finally, an important one here is patients who are hemodynamically unstable or have severe electrolyte imbalances, which Jolene explained earlier as a contraindication for both EN and PN. It would be very challenging to provide PN to these patients and not cause further problems down the line. Once it's been decided that a patient requires parenteral nutrition, the next decision is the type of venous access that will be used. One of the most important considerations in making this decision is the anticipated duration of PN. So let's start with peripheral parenteral nutrition, or PPN. PPN is a temporary feeding method where the catheter is inserted into the small peripheral vein, typically in the forearm or the hand, using a short peripheral IV catheter. PPN is generally used for short-term support, typically no more than 7 to really maximum 10 days. It's appropriate when the patient only needs partial nutrition support, so not the full calorie or protein replacement, or it's appropriate to use when the PN needs are temporary, so while waiting for the central access, or the patient is transitioning to enteral or oral intake. Now, a critical consideration when using PPN is the osmolarity of the solution. Solutions infused into peripheral veins should not exceed 900 milliosmoles per liter to avoid vein irritation, phlebitis, or other complications. This limitation means PPN cannot fully meet the nutritional needs, especially in metabolically stressed patients. Now, in contrast, central parenteral nutrition, or CPN, is appropriate for both short and long-term nutrition support, and it allows delivery of those higher osmolarity solutions, including the full nutritional requirements. CPN requires that the catheter tip be placed into a central vein with high blood flow. So typically, we'd be looking at the subclavian vein, the internal jugular vein, or the femoral vein. This type of access is achieved using either a central venous catheter, a CVC, which is inserted directly into one of these central veins, or a peripherally inserted central catheter, or a PICC, which is inserted through a peripheral vein, typically in the arm, but extends so that the tip resides in the superior vena cava, making it a central line. Now, both CVCs and PICs are appropriate for administering TPN since they deliver the solution directly into the central circulation. While the terms CPN and TPN are often used interchangeably, they technically describe different aspects of the therapy. CPN refers to the route of administration through the central vein, while TPN refers to the composition of the solution. We're talking about a complete formula that meets 100% of the patient's nutritional needs. That said, they do often overlap in practice. Because TPN must always be infused via a central line, the access route is almost always CPN. Here's a slide to show you the breakdown of what PN solution is composed of. Typically, it's a mixture of carbs, specifically dextrose monohydrate, protein in its most broken down form, amino acids, lipids, fluid, and then a mixture of electrolytes, vitamins, and trace minerals. There are many different mixtures out there that contain varying amounts of all of these nutrients, and it's important for you to learn how to pick which one is most appropriate for your patient. So with that in mind, let's dive into each one of these components a little more deeply. Let's start with carbohydrates. So carbs are mainly supplied, as I said, in the form of dextrose monohydrate. The first important thing to note here is that dextrose yields 3.4 kcals per gram, not the usual 4 that you use in EN. And this is a key difference to keep in mind for calculations. From an osmolarity standpoint, dextrose accounts for about 5 milliosmoles per gram. And this is important to know, especially when you're calculating the osmolarity for ppn. Now, when it comes to determining the appropriate amount of carbohydrates for a patient, aim for up to 5 grams per kilogram of body weight per day. This will vary a bit based on the patient's body weight, so assure that the dextrose amounts for about 40 to 60% of the total kilocalories provided. Also, keep in mind that the dextrose solutions are supplied in a variety of concentrations, from 5 to 70%, with the common ones listed in this table here. If you see D50W, this signifies that the concentration equates to 50 grams of dextrose in 100 milliliters of water. And if you look at the graph, I have broken it down into each concentration percentage to visualize this concept. The reason we offer these different concentrations is because the higher dextrose concentrations are used to decrease the total volume, which is great for patients requiring a fluid restriction. Let's explore the key points about protein now. First off, protein is just slightly more energy dense than carbs in PN, providing about 4 kcals per gram. This is the same as enteral nutrition. Secondly, proteins in PN solution contribute to osmolarity as well, and they typically have an osmolarity of 10 milliosmoles per gram, also higher than carbs. PN solutions must contain all of the essential amino acids, and then a variety of non-essential amino acids as well, but there is more variation in the latter. When determining the appropriate amount of protein for a patient, it usually ranges anywhere between 0.8 to 2 grams per kilogram per day. And what we provide is highly dependent on the patient's condition. Similar to carbs, protein parenteral solutions come in a variety of concentrations to meet different patient needs. Some common concentrations include 3.5, 8, 10, and 20%. Also, like carbs, the concentration percentage tells you how many grams of protein there are in 100 milliliters of solution. So, for example, an 8% amino acid solution contains 8 grams of protein in 100 mil of solution. And the rest of them are listed in the table next to me here. Finally, there's a useful conversion to remember that Jolene also mentioned earlier. 6.25 grams of protein yields 1 gram of nitrogen. This conversion will be used when finding the different calorie to nitrogen ratios, and these are calculations we'll be going over later in this lecture. Now let's move on to lipids in PN. Unlike carbs or proteins, lipids have a higher energy density, providing approximately 10 kcal per gram. And this is a high energy yield that's due to the glycerol backbone that's present in lipid emulsions. This is different from EN, where it's 9 kcal per gram for lipids, okay? So keep that in mind. Now, I mentioned earlier that in PN, we get carbs in the form of dextrose and protein in the form of amino acids. Lipid emulsions typically contain long chain triglycerides in the form of soybean or safflower oil, with egg phospholipids, glycerin, and water. When it comes to osmolarity, lipids do not contribute to it. They have an osmolarity of 0 milliosmoles per gram, making them suitable for patients with fluid-sensitive conditions. This is important to remember because they like to trick students with this. Now, it's essential to consider the recommended intake of lipids for patients. The maximum recommended intake is 2 grams per kilogram per day, and providing between 1 to 1.5 grams per kilogram is pretty common. Typically, we aim for lipids to contribute about 20 to 40% of the total kcals provided. Lipid emulsions come in various concentrations as well, each offering different energy densities. And here are the three common lipid emulsions. Please note the unit here. A 10% lipid emulsion provides 1.1 kcals per milliliter, not gram in this case. A 20% lipid emulsion provides 2 kcals per mil, and then finally a 30% lipid emulsion provides 3 kcals per mil. These and the concentrations from the last two slides should all be memorized so that you can easily complete PN calculations. Finally, fluid is another one to be mindful of. A good rule of thumb is to follow the 30 to 40 mil per kilogram of body weight per day to meet normal hydration needs. Normal prescriptions typically range from 1.5 to 3 liters per day, and once again, they are highly dependent on the patient. When you get into clinical nutrition, there will be a lot more to this than what I am explaining. But for the purpose of this exam, the best method for you to use will be the easiest and quickest one. So 30 to 40 mil per kilogram body weight. Remember that. Let's delve into the different types of parenteral solutions, which are offered in either 2-in-1 or 3-in-1 formulations. And these formulations differ in their composition, their flexibility, and applications, so understanding their nuances is vital for clinical practice. Let's start with the 2-in-1 formulation. This type combines dextrose, amino acids, electrolytes, vitamins, minerals, trace elements, and sterile water. However, it distinctly lacks lipids, which are added separately as seen in the graphic. This configuration offers more flexibility in adjusting the amounts of dextrose and amino acids based on a patient's specific needs. So, for example, in cases where lipid restrictions are required due to certain medical conditions, such as pancreatitis or liver disease, we can adjust the lipid components separately without affecting the dextrose and amino acid composition. However, it's important to note that the increased flexibility comes with a higher cost. 2-in-1 is more expensive than the 3-in-1 formulation. With that said, let's look at the 3-in-1 alternative. This version is also known as total nutrient admixture, or TNA, because this formulation combines dextrose, amino acids, and lipids into a single solution. Unlike 2-in-1, this formulation offers less flexibility in adjusting macronutrient ratios. The proportions of these components are predetermined and less customizable. However, 3-in-1 is generally less expensive and more practical. The fact that it's pre-mixed means that it streamlines the preparation process and it helps with cost saving in the long run. As a dietitian, you will need to weigh factors such as flexibility, cost, and patient needs when selecting the most suitable option for each clinical situation. Now let's shift gears a little bit and start tackling calculations. Keep the information we just discussed on the last few slides in mind, as this will be valuable for the next steps. We will be going over how to do these different types of calculations today. First, we will go over how to calculate the osmolarity of PN solution. Then we will go over how to calculate the individual macronutrients in PN solution. The RD exam also occasionally tests students on their ability to calculate glucose infusion rate, or GIR, in PN solution. So we will learn the formula and how to complete that. Next, you will learn how to calculate nitrogen ratios. And then finally, we will finish this section with how to account for propofol in PN. Now, if you don't know what that is, don't worry about it. I will explain it shortly. Now let's dive into how to calculate the total osmolarity in parenteral nutrition solutions. We would typically follow this process. First, we calculate the osmolarity contributions for each individual component. So remember, we have to do dextrose, we have to do amino acids, and then another one here that I didn't mention earlier is electrolytes. But we would not do lipids because they contribute 0 milliosmoles per gram. Okay, so first we would multiply the grams of dextrose per liter by 5. We would multiply grams of protein per liter by 10. And then finally multiply the grams of electrolytes per liter by 1. And that's if they are provided in the problem, which they're not always. Then we would add up the osmolarity contributions from each component to determine the total osmolarity of the solution. Finally, remember that for PPN, where solution is administered through the peripheral veins, we need to ensure that the total osmolarity is kept below 900 milliosmoles per liter, and this precaution helps minimize the risk of vein irritation. That is why we do this. Let's illustrate the process with an example. What is the total osmolarity for 1 liter of D10W, so 10% dextrose in water, and 1 liter of 8% amino acid solution? Is it suitable for PPN? Let's go ahead and calculate the osmolarity contributions first. Note, we aren't given electrolytes here, so we do not need to include that. First, we need to find the grams of dextrose. For the D10W solution, remember we have 10 grams of dextrose in 100 ml of water, which translates to 100 grams of dextrose in 1 liter of solution, because 1 liter is the same as 1,000 milliliters. We then multiply 100 grams of dextrose by 5 milliosmoles per gram, and we get 500 milliosmoles in 1 liter of D10W. Now, for the 8% amino acid solution, that's the same thing as saying we have 8 grams of amino acids in 100 milliliters, and that translates, same thing, to 80 grams of amino acids in 1 liter of solution. We then multiply 80 grams of amino acids by 10 milliosmoles per gram, and we get 800 milliosmoles in 1 liter of 8% amino acid solution. Adding these up, we get a total osmolarity of 1,300 milliosmoles per liter. Since this total osmolarity exceeds the recommended limit of 900 milliosmoles per liter for PPN, the solution is not suitable for PPN administration. So as you can see, understanding and memorizing the basics we mentioned earlier in the slides will be vital for tackling these calculations. This is also a very simple one to start us off. The way that they can make this trickier is by adding lipids and electrolytes. So you would have to remember to calculate the electrolytes and ignore the lipids in this case, which don't contribute to osmolarity. Also, they may provide something other than 1 liter of solution, so understanding how to do your basic conversions is also going to be very important. Let's move on to our next type of problem. Let's walk through the process of calculating the nutrient content in a PN solution using a specific example. In this example, we'll use a solution of 300 ml of 50% dextrose, 500 ml of 8% amino acids, and 200 ml of 20% lipid. With a delivery rate of 50 ml per hour, find the total kcals from each nutrient in a day. And just to clarify, this PN solution with the 300 ml 50% dextrose, the 500 ml 8% amino acid, and the 200 ml of 20% lipid, that's what's written on the formula bag. These 300, 500, and 200 ml do not add up to the total PN volume provided in a day. So do not make the mistake of simply adding these up to find the total volume. The total PN volume can be higher or lower depending on the feeding rate. So the first step is going to be to determine the total volume of the PN solution delivered in a day. What we'll do here is we'll multiply the delivery rate by the number of hours in a day. So 50 mil per hour multiplied by 24 hours per day gives us a total of 1,200 mil per day. Step 2. Now let's calculate the kcals from dextrose specifically. We'll start by finding the total volume of dextrose in the solution. To do this, we start with the 1,200 mil we just calculated, and we will multiply that by 300 mil because we have 300 mil of 50% dextrose, and we will divide that by the volume of each macro that is provided. So 300 mil of dextrose plus 500 mil of amino acid plus 200 mil of lipid. We do that and we get 360 mil of dextrose. This is how much dextrose we have in that total 1,200 ml of solution provided over 24 hours. Next, we calculate the grams of dextrose. The question says that we have 50% dextrose, meaning that we have 50 grams dextrose per 100 ml of solution. So 360 ml of dextrose, we just calculated, times 50 grams divided by 100 ml. The mil cancel out, and we get 180 grams of dextrose. Finally, we need to find the kcals from dextrose. So to do that, we will multiply the grams of dextrose by its energy density. And remember, in this case, it's 3.4 kcals per gram, not 4. So 180 grams of dextrose times 3.4 kcal per gram. The grams cancel out, and we are left with 612 kcal of dextrose. So this PN solution provides 612 kcals from dextrose in a day. Now let's move on to calculating how many kcals we get from lipids in this PN solution. And for this, we wanted to share two methods of getting this value. First, method 1 involves calculating the total volume of lipids in the solution and then determining the kcals based on the concentration of lipid emulsion. So the first step is the same as it was for carbs. Use the 1,200 ml of total volume, and we're going to multiply that by 200 ml of lipid divided by 300 ml dextrose plus 500 ml amino acid plus 200 ml of lipid, and we will get 240 ml of lipid or fat. That's how much lipid we have in the total 1,200 ml of solution provided over 24 hours. From here, we can then find the total kcals provided by lipids. Since the 20% fat emulsion provides 2 kcal per mil, as we were saying earlier, we multiply the total volume of fat by the energy density. 240 mil times 2 kcal per mil, that cancels out the mil, and we're left with 480 kcals. Now, how about method number 2? This one involves directly calculating the kcals from the known grams of fat in the solution. So we would start by finding the grams of fat using the concentration of lipid emulsion. 200 mil times 20 grams divided by 100 mil because it is a 20% solution. We would cancel out the mil and we would get 40 grams of fat. Next, we could determine the kcals from fat using the energy density of 10 kcal per gram, not mil here. Be mindful of your units. You're going to multiply 40 grams of fat by 10 kcal per gram, and we get 400 kcals. There is one final step here, though. You have to account for the total volume of the solution. So you're going to take your 400 kcal and you're going to multiply that by 1,200 mil and divide that by 1,000 mil. Where does the 1,000 mil come from? That's the total volume provided in the problem. So it's your 300 mil dextrose, your 500 mil amino acid, and your 200 mil lipid. And you're going to get that 480 kcal of lipid. So, as you can see, both methods yield the same amount of kilocalories, 480. You can choose whichever method is easier for you to understand. You do not need to do both. Okay, step 4. Let's find the kcals from amino acids in our PN solution. So same as carbs and method 1 lipids, we will first calculate the total volume of amino acids in the solution using the given concentration and total volume of the PN solution. So 1,200 mil times 500 mil of amino acid divided by the 300 mil dextrose plus 500 mil amino acid plus 200 mil of lipid, and we get 600 mil of amino acid. Next, we calculate the grams of amino acids using the concentration provided. 600 mil, we just calculated, times 8 grams divided by 100 mil, because it's an 8% amino acid solution, and the mil cancel out, we get 48 grams of amino acid. Finally, we find the kcal from amino acids by multiplying the grams by the energy density of 4 kcal per gram. 48 grams times 4 kcal per gram, the grams cancel out, and we're left with 192 kcal. Therefore, the PN solution provides 192 kcal from amino acids in a day. Note that if the question asked for the total kcals, you would simply add each kcal calculated from dextrose, lipids, and amino acids to find the answer. RD exam questions can be this long, but they may also be broken up where they ask you to find the kcal or even just the grams of one specific macronutrient. Always read the question thoroughly to understand what they are looking for exactly. If they ask for grams or kcal of one macronutrient, find the total volume, then complete the calculation for the specific macro. This completes our calculation for the nutrient content of the PN solution. So now let's move on to our next type of calculation. Let's delve into the concept of glucose infusion rate, or GIR, in parenteral nutrition. GIR is a measure of how quickly a patient receives carbohydrates. It's reported in milligrams of dextrose per kilogram body weight per minute. This metric helps healthcare providers monitor and adjust the rate of carbohydrate delivery to prevent complications like hyperglycemia or refeeding syndrome. Refeeding is caused by digesting dextrose and then depleting phosphate. Protein and fat intake actually do not cause refeeding syndrome, which is why we're only looking at dextrose here. Now, for GIR, the main thing you need to do is memorize the following formula. So infusion rate in mil per hour times dextrose concentration in grams per mil times 1,000 milligrams per gram. And we divide all of that by weight in kilograms times 60 minutes per hour. This formula considers the infusion rate of the PN solution, the concentration of dextrose in the solution, and the patient's body weight. Those values would be provided in the problem, while the 1,000 milligram per gram and the 60-minute per hour will always remain the same in the formula. And it is so important to keep track of your units in this question. For example, they sometimes trick students by providing the weight in pounds instead of kilograms. So make sure that the provided values have the correct unit. And if not, fix it before plugging in your values into the formula. Finally, it's important to note that the GIR should typically be kept below 4 milligrams per kilogram per minute to avoid the risk of hyperglycemia and refeeding syndrome. And this is especially in patients with compromised metabolic function. Let's do an example together on the next slide. Let's calculate the GIR for a 55-year-old patient who weighs 75 kilograms and is receiving PN solution containing 20% dextrose running at 80 ml per hour. First thing we should verify are the units, which in this example are exactly as they should be, so we could plug in the values directly. The infusion rate is 80 ml per hour times 20% dextrose, which equates to 20 grams of dextrose over 100 ml, and we input it into the formula that way, times 1,000 milligrams per gram. And we're going to divide all of that by 75 kilograms body weight times 60 minutes per hour. As it plays out, the units cancel out, and we are left with 3.55 milligrams per kilogram per minute. Therefore, the GIR for this patient is approximately 3.55, which is under 4, as it should be. Let's move on to nitrogen ratios in parenteral nutrition. These ratios provide valuable insight into the balance between protein intake and non-protein energy sources in the patient's nutritional regimen. There are three main nitrogen ratios commonly used in clinical practice. We have protein calorie to nitrogen ratio, non-protein calorie to nitrogen ratio, and then formula calorie to nitrogen ratio. To calculate any of these ratios, we must first determine the amount of nitrogen present in the parenteral nutrition solution. Remember that 1 gram of nitrogen is equivalent to 6.25 grams of protein. Therefore, we can use this conversion factor to find the grams of nitrogen in the solution. So let's go over an example together now. Let's say we're given the following question. The first step would be to calculate the grams and kcals for each macronutrient in the given PN solution, which contains 500 ml of a 50% dextrose solution, 500 ml of a 10% protein solution, and 100 ml of a 30% fat emulsion. We'll then use these values to determine the protein calorie to nitrogen ratio, the non-protein calorie to nitrogen ratio, and the formula calorie to nitrogen ratio. So let's calculate the macronutrient grams and find the total kcals, exactly like what we were doing earlier. For carbs, we have 500 ml dextrose times 50 grams over 100 ml because 50% dextrose solution. The mils cancel out and we get 250 grams. 250 grams times 3.4 kcal per gram equals 850 kcal. Next, protein. 500 ml times 10 grams over 100 ml because it's a 10% protein solution. The mils cancel out, we get 50 grams of protein. Convert that to kcals. 50 grams times 4 kcal per gram equals 200 kcal. Finally, fat. We have 100 ml, and here we can find the kcals directly. 100 ml times 3 kcal per ml, because it's a 30% fat emulsion, equals 300 kcal. Add all of these up, 850 from dextrose plus 200 from amino acid plus 300 from lipid, and we get 1,350 kcals total. Now, let's move on to calculating the nitrogen content and then use that to find the respective ratios. Starting with finding the grams of nitrogen. We found that the PN solution contains 50 grams of protein. So let's convert that to nitrogen. 50 grams of protein times 1 gram of nitrogen divided by 6.25 grams of protein. Grams of protein cancel out, and we are left with 8 grams of nitrogen. Now we can dive into finding those ratios. Step 3. Let's first find the protein calorie to nitrogen ratio. Remember, in the first step, we also found the amount of calories protein contributes to this PN solution, which was 200 calories. So we divide 200 kcal protein by 8 grams of nitrogen, and we find that the ratio is 25 to 1. What this means is that for every 25 kcals provided by protein, there is 1 gram of nitrogen present in the solution. Next, let's calculate the non-protein calorie to nitrogen ratio as well as the formula calorie to nitrogen ratio. Starting with that non-protein calorie to nitrogen ratio, we sum up the total non-protein calories from carbs and fats. Then we're going to divide that by the grams of nitrogen. So 850 kcal from dextrose plus 300 kcal from lipids, that equals 1,150 kcal. We divide that by 8 grams of nitrogen, and that equates to 143.75 to 1 for the ratio. Now, according to the American Society for Parenteral and Enteral Nutrition, which we call ASPEN for short, the recommended range for critically ill patients typically falls between 70 to 1 to 100 to 1, while for stable patients, it ranges from 150 to 1 to 200 to 1. Now, let's proceed to step 5. This is going to be the formula calorie to nitrogen ratio. This is the last one. To find this one, we're going to divide the total calories that we provided in the first step, and we're going to divide that by the grams of nitrogen. So 1,350 kcal divided by 8 grams of nitrogen equates to 168.75 to 1. Now, once again, the RD exam would likely not ask you to calculate each one of these in one question. They may ask you to simply calculate one of them. So it is important for you to understand how to tackle each type of calculation. Now let's move on to our last type of calculation. And that is the inclusion of propofol in PN regimens. Propofol is a commonly used intravenous anesthetic drug for sedation in critically ill patients. Now, interestingly, it can also serve as a source of calories when combined with parenteral or enteral nutrition. So, propofol is typically delivered in a fatty emulsion, providing approximately 1.1 kcal per mil. When incorporating propofol into a parenteral nutrition regimen, it's crucial to account for the calories it contributes. That means adjusting the macronutrient distribution to accommodate the additional energy provided by propofol. So let's go over an example together. Let's calculate the total calories the patient will receive from propofol daily. Given that propofol provides 1.1 kcal per mil and the patient is receiving 30 cc per hour, which is the same as 30 mil per hour, we can calculate the daily calorie intake from propofol. So 30 mil per hour times 1.1 kcal per mil would give us the amount of propofol in 1 hour. But there are 24 hours in a day, so we then multiply it by 24 hours, and that equals 792 kcal per day. And that is not an insignificant number of calories, right? That is why it's crucial to consider this calorie intake from propofol when calculating the patient's total energy requirements and adjusting their nutritional regimen accordingly. And that's it for this ENPN lecture. Thank you so much for watching this video. It means so much for us to have your support. Don't forget to fill out the provided worksheet and answer the practice questions to test your understanding of the material. And if you like what you saw here today, please check out our website, preptable.org, for more RD exam lectures. You can purchase either domain packages or our Pass the RD Exam Complete program on our Teachable website. Feel free to also reach out to us via email at team@preptable.org if you have any questions about the material we covered today or any questions about our program. As always, happy studying!